Hi, I just want to go over some of the features of Medix on the Go with you. Before you launch Medix on the Go, you want to be sure that you turn your Google Maps on. This is something that is stipulated by Google Maps when you're using it within an application. So I just turn it on and back out of it and open Medix on the Go. The first screen that you're going to get is asking you to choose a state. For right now, I'm going to choose Michigan, and then it will give you a list of protocols. I'm going to choose the HIMSS protocols. Those are Wayne County in southeastern Michigan. Next comes the disclaimer, and it's long, but it's going to ask you to accept it or decline it. If you decline it, then it'll back you out of the application altogether. When you accept it, it's going to take you to a screen where you can put in some demographic information. It's going to ask you to enter the patient's age. Let's say that we have a 3-year-old that weighs 20 pounds, and we're going to put in a run number. Any run number will do. And hit enter. Next, it's going to pull up your protocol types. Let's say that we're going to go to Peds Cardiac. Let's say we have a patient that's bradycardic. By pressing that button, it's going to pull up your bradycardia protocol. You'll notice at the top, you have a button that says update weight next to a button that says pounds. If you did not put in your weight in the patient and you just closed out that screen previously, this is going to give you a chance to put the patient's weight in. This is important when you're dealing with drugs that are weight-based. Below that, you're going to see the button IVO2 and monitor. These are procedure buttons. When you do something, just press it. You start an IV, you put the patient on oxygen in the monitor. It just grays it out to let you know that you've touched it. The button is still active. And you'll notice under that, you have your 2 drugs, epinephrine and atropine. And you'll notice that the dosages that are on the button are based on the patient's weight that we put in before. Below that is the protocol itself. You'll notice in some protocols it may refer you to a different protocol. Let's say that this one is going to refer us to Pediatric Assessment and Treatment Protocol, and we just want to go over that. We touch that button and it takes us to that protocol. You'll notice that the IV normal saline bolus dosage amount for the bolus is already populated on the button. Now, when you push these buttons at the top, it's going to issue a date time stamp into your summary. Your summary is stored in your device, and it will always be there for your review. So let's say that we give them an IV bolus. We can review the protocol below. Let's say that next we want to go into pediatric trauma protocol. We just press it, and there's your protocol. Let's go to the runner code feature for a second. In the runner code feature, you have some really nice effects that you have access to. Let's say our patient goes into pediatric asystole or PEA. All you do is touch it, and you'll notice in the upper left-hand corner, you have a timer. When you hit start code, that timer is going to start, and that's going to give you an indication of how long you've been working that code. You'll see you'll have a monitor, oxygen, airway, and IV button again, and an update weight and a blank field. In that field, you can put your patient's weight if you have not done so before. So on every screen, it's giving you the opportunity to update the patient's weight. Below that are more clickable buttons. So when you do a procedure or you give a drug, all you have to do is push the button and it issues a date time stamp into your summary. So let's say that we do another IV bolus and then we give them epinephrine. You notice that the dosages are calculated out on the button. So when you hit start code, this is when you're going to start to get verbal indicators. Let me turn the sound up so you can hear.
Start CPR. Consider causes. Hypovolemia. Hypoxia. Tension pneumothorax. Hypothermia. Hypokalemia. In a dialysis patient, give calcium chloride and sodium bicarbonate.
So I'm just going to hit the mute button for a second. So you can see that it's giving you verbal cues. These cues are on a timer. So it's going to say start CPR. In 2 minutes, it's going to say stop CPR, check pulse, and continue CPR if appropriate. You give your first dose of epinephrine. 3 minutes later, it's going to say give your next dose of epinephrine. You have stop code buttons when you want to stop, mute, and when you want to close it and go back. So let's go to the call report route me screen in the bottom left-hand corner. This screen is here for security reasons. Some systems issue telemetry phone numbers for you to be able to call the hospital to call in your report. These are security numbers. And in order for us to approve you to be able to have access to these numbers, we first must verify your licensure in your state. So we're asking you to fill out this information. You hit the submit button. It sends us an email. We verify that information, and then we unlock the calling feature in your phone. But until then, you can use the maps. And all you have to do is press use maps only, and then it will open up Google Maps for you. So on Google Maps, you will see markers. These markers are for your system approved hospitals. All you have to do is press a marker, say Beaumont, Troy, and to route yourself there. In the bottom right hand corner, you see that little Google key? Just touch the Google key, and it will start to route you to that destination. So we can make it there in 31 minutes. All you have to do is press the little car button, and it will start navigating you. So let's go back to the summary screen. Remember all those date time stamps I was talking about? They are. There's my run number, the patient's weight, the patient's age, and all the buttons that I press: monitor, IV normal saline bolus, epinephrine. All of the drug buttons that we pushed are here into your summary. So I hope you liked the program. Feel free to drop me an email at any time. I appreciate any comments or suggestions, and I will get back to you as soon as possible. Thank you for using Medics on the Go.